Okay, so we're now going to hear some of those task and finish groups, what they've been up to, and the first one is prevention. And so can I introduce Clare Forshaw, who's head of the Centre for Health at the Health and Safety Executive. And can I just check, anybody using the loop, is it loud enough? Any problems? You fine? Right? Okay? Clare.
Good morning, everybody. It's great to see a room full of enthusiastic people here today. So I've been honoured to take on the role of chairing the Prevention Task and Finish Group. And this really followed on from an event I held exactly 12 months ago, which was aimed at bringing together in a very similar way interested parties, multidisciplines interested in hearing conservation, to try and emulate something that they have over in the States, where they have a National Hearing Conservation Association, which, as I say, in a similar way, brings together all interested professions in academia to say, how do we work together to achieve impact and learn from each other and continuously develop our science. So, as I say, I was honoured to take on this role and extremely pleased to see that really at the beginning of the action plan on hearing loss, we have the ambition to invest in prevention. And prevention really is at the heart of what I do in my role in the Health and Safety Executive. And so for me, it really has to be an integral part of any strategy or plan to make an impact on health outcomes. So it was great to see prevention in there. And as I say, I'm very pleased to be involved with a great team on the working group of experts and passionate people who also agree that this is really important. And I heard from Sir Malcolm Grant, Chair of NHS England, at a construction health event last year, who again acknowledged that we need to do more about prevention if we're going to have any kind of sustainable future for the health of our society. So, you know, we're all starting to recognise the importance of intervening early and tackling some of the problems at source where we can. So, all the great stuff you're going to hear about today is all built upon another, angle, which is about intervening at source, a root cause, and influencing people, influencing attitudes and behaviours towards, particularly what I'm going to talk about today is towards noise and that effect on hearing loss. But as part of the working group, something I won't mention today, but I will flag, that we have looked at clinical interventions, so where we can intervene early through clinical pathways to still influence prevention and educate people how that can happen. So we've not progressed that part of the work very far yet, but it's certainly on our radar within the working group. So I'll just introduce to you the kind of three priority areas that we're tackling at the moment. And what we felt was, as a group, was that there's a lot of evidence out there, and there's been a lot of campaigns over the years and a lot of different interested parties who want to communicate and improve awareness and improve attitudes towards hearing loss. But there's no kind of consistent flow through all of that. So we thought as a group it'd be great if there was a kind of bank of evidence-based, powerful messages that people could access. And when we think about behaviour change, really consistency is key. So we don't change the messaging, every year to say, oh, let's have another message this year, and you kind of lose the impact of what you started the year before. So if there was a bank of messages that all stakeholders could access, the important thing is that they're evidence-based, so we can have confidence in those messages, and also that they're kind of targeted at key groups that we want to influence, because we kind of know the areas we want to make the most impact on, the ones that are causing the most harm and the most effect on our population. So let's work to do that. So that's something we've been working on. And there's just some examples here, and these ones, aligned to what Fiona said earlier, are based on the kind of cost impact, the financial burden of not tackling hearing loss and not intervening early. So there are some examples around the room, and I say this is just the cost ones that I'm going to show you today. So demonstrating the cost of not intervening, and then that actually there's a cost benefit if we do tackle noise-induced hearing loss, and there are cost-effective ways of doing this. So some real powerful financial messaging around why we should be tackling it and kind of why we're here today. Another area we've been looking at, again related to behaviour change, is to look at the potential for a test that a lot of you will be familiar with, autoacoustic emissions testing. And this is our kind of standard newborn hearing test, but that it has shown potential to influence attitudes towards noise in adults, where it's been used in occupational settings. So we really thought as a group that this would be an interesting area for us to look at. It has, as I say, been shown scientifically that it's a robust and valid test. And it's also kind of shown a behavioural influence. So when people are tested using pure tone audiometry, it can be quite late to demonstrate that people have been affected by noise. And it's not a very engaging test sometimes when you've got to concentrate and listen and try and focus on hearing those pure tones. Whereas the autoacoustic emission testing has really added another dimension to that testing programme, where people are picking up changes in their hair cell function much earlier than what's been shown on pure tone audiometry. So it gives people a chance to actually act on those results, rather than saying, you've got a permanent hearing loss and now we need to deal with that. So we're really looking to pilot this now and sort of engage with businesses and within the military to get the test into workplaces to see not only how it works in changing attitudes and behaviours, but also the kind of practical issues of, does it work? So that's an area we're looking at piloting going forwards. And the kind of other area where we're interested in is a new way of educating. I think as a nation, we kind of have a fairly unhealthy relationship with noise and sound. Well, I've heard other colleagues speak about this, and if you think about when we hear or we see images or messages about noise, if it's loud, it's usually exciting and it's stimulating, and the louder the better. And it's young people are vibrant when they're in these big rock concerts, and the boring old people are like, turn it down. And that's the kind of converse thing is, it's quiet is boring and it's reflective and it's isolating, and but all our social cues tell us that loud is good, loud is great, and we kind of pick up on those cues. And so then when we say in workplaces and the like that, you turn it down, it's affecting your hearing, people go, no, you're so boring, I'll worry about that in 50 years time. So that unhealthy relationship we need to redress, and I'm really pleased that Professor Deanna Meinke has come all the way from the University of Northern Colorado today to talk to us about a Dangerous Decibels program that she is one of the co-founders for, which is a behavioural education, evidence-based education program that we're looking to pilot going forwards again. And if any of you can stay on for this afternoon to engage with Deanna further in a workshop to hear more about the Dangerous Decibels program, it would be great if you could do that. But for now, I'll hand over to Deanna to talk to you more about the Dangerous Decibels program.